It is the Ortho Nebraska halftime show, brought to you by Ortho Nebraska. It is 41-13, Millard South leading Millard North at the break. Millard North dance team performing here at the half. As we send things down to the field where Bill Steckus is standing by with a member of Ortho Nebraska.
Yes, and his name is Dr. A.J. Abcejo, a primary care sports medicine physician, and we're going to talk about concussions. Very important subject. So if a parent or somebody thinks that their loved one or whoever might have a concussion, what are they looking for?
A lot of the times concussions can present oddly, and so what parents really need to look for are a couple physical things. Their kid might be complaining of headaches, a little bit of nausea, some just sheer fatigue. They might say, I'm a little bit sensitive to light, sensitive to noise. They'll also have some sleep issues, so they might say, I'm having trouble getting to sleep, staying asleep, or falling asleep. And then some behavioral stuff that actually might be a little bit more emotional. So sometimes they might be irritable, more so than usual. And then lastly, they might just have some cognitive things, a little bit more forgetful, harder to concentrate. Sometimes they just say, I'm a little bit foggier than usual. Yeah.
So those are some telltale things to look at. What about new protocols, anything in that area?
A lot of the times when I see an athlete for concussion, the biggest thing I just tell them is we just need to rest the brain. So I just want to make sure that a lot of the symptoms we just talked about at least are symptom-free for at least a day. Once we're at that point in time, then I can get them back to school for at least a half day. And then after that half day, if they're still symptom-free, then we progress them to a full day, and then finally we get them back onto the field, at least starting to work with their physical trainer or athletic trainer at school, so that way we can get them back on the field. And sometimes that can take 1 to 2 weeks.
And you know, I was fascinated to hear that you can actually do some things to possibly prevent concussions. Like I said, that was new to me.
Yeah, a lot of times preseason, what a lot of these athletes are going to be doing with their athletic trainers is an impact concussion screening test, which measures their memory, their attention span, visual and verbal problem-solving skills. So that way, if they get a concussion during the season, we can at least measure it to their original baseline before they had any symptoms.
All right. Yeah. Thank you, doctor. We appreciate it. If you need them at 8 a.m. in the morning on Saturdays, the injury clinic is open at 144th and Center, guys. Thank you.
Very good to know, Bill. Appreciate it. When we come back, we'll look at first half highlights. There were a lot of them. That's after this.